Got bunions? Well, if you're watching me right now, you either have them, you think you do, or maybe you know someone who does. Well, guess what? I don't have bunions as of about 2 months ago, and I'm just thrilled with the results. Now, many of you out there might have looked on the internet like I did, looking at bunions, what are they, looking at surgery, seeing those horrible scars and screws, and I did too, and I thought, okay, that's just not for me. So what I decided to do is throw up the universe, all right, bring something in, and lo and behold, about a week later, this brochure came in the mail. And I looked at it and I thought, wow, minimally invasive foot surgery, what is that? So I made an appointment and I met with Dr. Weber, and I was very, very impressed with him. And he basically explained what I had. I thought I had 2 bunions, turns out I had 4. And I really appreciated his kind, gentle demeanor, and I made an appointment that day for my left foot, and then 2 weeks later I did my right foot on March 14th, and I was very, very pleased with the results. I had surgeries on Friday and I went back to work the following Monday. I am an elementary school teacher, so I am on my feet much more than off of them, and through the whole process all I needed was 2 ibuprofen. So there was just minimal pain, minimal discomfort. I was able to drive the next day. Highly recommend this process. I've had all kinds of people, including doctors, asking me about the procedure, showing me their feet, and they're very excited to see the result that I've had. So, questions you might have. First of all, we talked about the pain. Is it painful? No, not so much. Now, the first time I had my left foot done, I was asleep through the whole process. The second time, when I had my right foot done, I woke up and I saw an x-ray of my foot. Now, the reason why this process is minimally invasive is because Dr. Weber has an x-ray of your foot right on the screen, so he knows precisely where to go into the foot. There are no screws in my feet. I have 2 maybe half-inch scars that I'm convinced in about maybe another month or so will totally be gone. So I'm very excited about that. I'm walking fine. There's just maybe a little sensitivity in the toes, but again, I would recommend this process to anyone. I've had people coming up to me saying, oh, I don't want bunion surgery because I have to be off my feet for 1 to 2 months, and they're just amazed that I was walking immediately after the process. So you might be wondering, okay, I have bandages, what happens when I shower? Well, we have something called Zero Socks here. So basically what happens is you put this rubber boot over your foot in your bandage, and then you take the little pump and you place it here, and guess what? The hole in the end pumps out the air. How about that? So then you can go right into the shower and with no problem. And then right after the surgery, you will be fitted with one of these attractive shoes here, and then you will be wearing that for approximately 6 weeks or so. I was 6 weeks, and then I did the other foot, as you know, 2 weeks apart, so that worked out well. And then also, you will be fitted for a prosthetic, and those will be placed in your shoes, and you'll need to wear those to protect your feet. Another thing that really has impressed me with this whole process is the staff here. I have had an opportunity to meet all the doctors. Dr. Weber, of course, was the surgeon, and he comes in and checks on his patients all the time. I was very impressed with that, and guess what? It's the doctors that wrap the feet, not the nurses or the x-ray techs, and they are all wonderful. I've gotten to know all of them, and they just make you feel very, very comfortable, and any kind of question or concern, personal concern that you have about your foot issues, they're addressed immediately. So I've been, again, very impressed with this whole process.